The type and style of running shoe that each runner chooses is up to the individual runner. Each runner should find shoes that work best for their feet and legs in terms of providing proper support for running. It is important to have more than one pair of running shoes and replace them frequently if you are an avid or competitive runner. Each runner's success depends on staying healthy, so that means having proper support for your feet and legs. If a runner continues to use a pair of shoes that are breaking down, the runner puts themselves at risk for injury. These types of injuries could include stress fractures, Achilles tendon issues, plantar fasciitis, and tight IT bands. Any of these injuries are a sign you need to change your shoes immediately, so it makes sense to have these shoes on hand. To determine the shoe that is right for you, first determine the degree of pronation of your feet. Pronation refers to the inward roll of the foot during normal motion and occurs as the outer edge of the heel strikes the ground and the foot rolls inward and flattens out. A moderate amount of pronation is required for the foot to function properly. However, damage and injury can occur during excessive pronation. When excessive pronation does occur, the arch flattens out and stretches the muscle, tendons, and ligaments underneath the foot. Supination or underpronation is the opposite of pronation and refers to the outward roll of the foot during normal motion. A natural amount of supination occurs during the push-off phase of the running gait, as the heel lifts off the ground and the forefoot and toes are used to propel the body forward. However, excessive supination or outward rolling places a large strain on the muscles and tendons, and can lead to ankle rolling completely over, resulting in an ankle sprain or total ligament rupture. You can determine the degree of pronation of your feet by conducting the wet foot test. This is done by wetting your feet and walking on a dry surface to create footprints. If your impression looks like this, you are a neutral pronator. 20 to 30% of runners are neutral pronators. You strike the floor with your heel, then while you roll forward with the toes, your arch lightly collapses inward, absorbing the impact. If your impression looks like the second one, you are an overpronator. In this footprint, you can see the whole sole of the foot. The arch of the foot stretches inward too much and does not absorb shock correctly and exposes you to injury. This last foot impression is that of an underpronator, or a supinator. A supinator's feet don't flex enough to provide effective shock absorption while running, making impact with the surface very hard and dangerous. The wet test will only give you a clue in the process of finding the right shoe. While many runners fall into the categories described by the wet test, some people have flat feet that are stiff, and some people have high but flexible arches. There are other variables such as your weight, biomechanics, running experience, and fit preferences that will also impact shoe selection. Before we move on to selecting shoes, let's take a moment to talk about plantar fasciitis. This is a common runner's injury. It is also commonly called flip-flop disease. For a competitive runner, flip-flops are shoe wear you want to avoid. With the hilly PLNU campus, flip-flops become more of a problem. Remember, you are counting on your feet, legs, and heart to carry you to success, so you better be prepared to take good care of them, or expect to experience failure because of injury. Joy Dahlberg, a former PLNU assistant coach and NAIA cross-country All-American in 2002, will tell you that running shoe manufacturers make 3 types of shoes: cushion or neutral shoes, stability shoes, and motion control shoes. In order to choose a shoe that is right for you, you need to be aware of how much flexibility your foot has. If you have a high, rigid arch that doesn't flex well when you go from heel strike to toe off, you'll need to be in a cushion or neutral shoe. If you have a normal, slightly flexible arch, then a stability shoe is right for you. Even slightly flexible arches do well in cushioned shoes, and it is better to err on the side of a cushioned shoe. On the other hand, if you have a completely flat foot or your weight exceeds 200 pounds, then a motion control shoe is a better choice. Motion control shoes are usually heavy and flexible shoes and cause you to run on the outside of your foot. Motion control shoes can cause injury, so you should not use them unless you have flat feet or are obese. The majority of runners are okay in a cushion or stability shoe, and it really depends on your preference. It is important to be able to identify these three types of shoes. If you look on the medial side of the shoe, where the arch is, and the material is all white or one color, this is usually a cushion shoe. These are safe shoes. If the shoe has a gray portion or darker color just in the middle, then it is usually a stability shoe. This material is called dual density rubber. This is the material that provides stability in the shoe. If the gray or darker color material goes all the way back to the heel, this is usually a motion control shoe. You should stay away from a motion control shoe unless you have extremely flat feet or if you are obese, because these shoes can cause injury. Mizuno is the only shoe company that doesn't use dual density rubber for their stability. They use wave plates, so it is a little trickier to tell which shoes are motion control. Look at the tag or the tongue of the shoe to find out the name of the shoe. Mizuno's motion control names are Renegade and Alchemy. Other popular motion control shoes are Evolution and Foundation by Asics and Hurricane by Saucony. It is also important to note that if you have a custom orthotic, that you should choose a cushion or neutral shoe for running. Using orthotic support with shoe support will have the effect of a motion-controlled shoe and will cause you to run on the outside of your foot. Since choosing the right shoes is a matter of personal preference to a large degree, it is important that you try on shoes before purchasing them. You need to see if they feel good and if they are right for your stride. A word to the wise: if a shoe is not comfortable when you first try it on, it will not become comfortable. By the time uncomfortable shoes start to break in, an injury is already in progress. If you are able to consult a running expert while selecting shoes, you will want to share your running and injury history, have them look at your old shoes, and see how you run. If you have a history of injury, it is prudent to consult with a medical professional, such as a sports podiatrist, certified athletic trainer, or physical therapist, to assist with appropriate treatment, a recovery training plan, and a more formal assessment of your running shoe needs. Now that you have a better idea of how to choose your shoes, let's talk about how many pairs you need. It is recommended that you have 2 pairs of training shoes at all times and keep a third pair ready to go. When one pair of your training shoes starts to wear down, replace them with the stored pair and demote the worn shoes for daily walking around shoes. Then you will replace the stored pair as you have time. Shoe manufacturers and running literature suggest that you change your shoes every 500 miles. So if you average 50 miles per week, then you should expect to need a new pair of trainers every 10 weeks. That equates to roughly 5 pairs of running shoes per year. If you average more than 50 miles per week, you will need more pairs of shoes. In conclusion, you should enjoy a healthy, lifelong running experience with shoes that serve your feet well rather than shoes that just look cool.